her a round of applause. And she's gonna talk about her well, you already just I'm sorry. You're gonna give her what did I just say? Sorry. She's gonna talk about her experience as an eating disorder dietitian. Okay. Then I have to let me pull up her slide. Oh, perfect. And then you can just like use the arrows to go where you want. Yeah. Thank you so much for having me. I know y'all just talked to another eating disorder dietitian, so any questions or things that you feel like you, information that you want that you didn't get or maybe want more. So hopefully I'm just not giving you the same information twice, essentially. But, okay, and this is like, I don't know how informal y'all will typically do it, but feel free, you can like jump in and ask questions too. It's not working. Click the arrow. Yeah. Is it not? Oh, okay. Well, I guess it's just there. Okay, so I'll talk a little bit about my undergrad program, grad school, my internship, kind of how I started as a dietitian, where I ended up or where I'm at now, day-to-day activities like what my life looks like as a private practice owner, and then advice for y'all as students, resources if you're interested in eating disorders and kind of learning more about eating disorders in the field, and then always have time for questions. All right, so a little about me. I'm a dietitian. Of course, I am a mom to be, so I'm expecting my first daughter in March. So thank you, but I'm also a dog mom and I love my dogs very much. So what breed? I have a pit bull and a hound. Yes. So yes, I'm a big pit bull advocate. So, I love reading. I'm a big reader. So if you know anything about Sarah J. Maas, we're in good company. And I love to bake sourdough. So fun things about me when I'm not talking to people about food. Okay, so I'm actually not from Louisiana. So some of the schools that I mentioned, you may not be familiar with, but I originally went to school to study fine arts, actually, in Pennsylvania, to study ceramics. And so I ended up going to school and essentially, without going into too much detail, what started off as like, I want to be healthy, spiraled really quickly into I'm struggling with an eating disorder. So through my recovery, I decided like, don't want to do the art thing anymore, and I want to be a dietitian, work with people with eating disorders. So transferred schools, changed my major, all that good stuff. I majored in nutrition, and essentially because of my transfer, I couldn't fully minor in psych, but I was like, because of the transfer. But I would recommend to take psychology classes if you are interested in disorders. I also participated in my Student Dietetic Association, just things that I did in undergrad. I started accruing shadowing hours in multiple different specialties. So this is kind of like some advice that I would give at the end. My stepmom is a renal dietitian, so I kind of had the ability to shadow her a lot and just meet other dietitians and just shadow them. And I volunteered at the local diabetes camp, which just gave me a lot of really good experience working with diabetes. Also, because I do sometimes see clients with kind of call it diabulimia, where we're withholding insulin in order to lose weight or restrict your intake. So it's helpful for that. All right, so my grad program, I moved to Louisiana in 2019 to study at FRANU. Have y'all heard of FRANU? Yeah. Yes, great program, highly recommend. I graduated in 2020, love the program, super diverse in the experiences that I got there. Of course, I feel like every year they're really updating and changing the program, so it looks a little different compared to when I was there. I did get some eating disorder experience, specifically with the LSU Student Health Center with Emily, who's the dietitian there. But now, not as much of the time, but now there's a lot. There's a couple more rotations where you can get eating disorder experience with me. I have been a preceptor there for the last year, but with moving into leave coming up in the spring, I'm going to be pausing in 2026 for brand new students, but I'm also open. I know Emily has shadowed with me before, and so if y'all ever are interested in coming to shadow with me. At this time, I knew I wanted to specialize in eating disorders, so I took as much time as possible to really do my own research, really. I mean, I already had experience with what treatment had looked like, but I did continuing eds, read a lot of books involving eating disorder care, webinars. My capstone project was focused on eating disorders and relapse, and so really like whatever information you can start accruing, because unfortunately I do feel like it's something that is not talked about enough in undergrad. Like I think I got like one slide in my M&T class maybe on eating disorders and my whole experience there. Okay, so career path. I took my exam in 2020. In 2021, in January, I started at the Children's Hospital here working as a pediatric dietitian. Depending on what area you would like to go into, I feel like peds was a great way to get introduced to eating disorders. Unfortunately, a lot of we know adolescents, teens, they're kind of the ones who are struggling a lot, especially with social media now and COVID and everything. So I did cover the NICU like throughout my time there. I left in 2023, but NICU, surgery unit, hematology, oncology, but in addition to that, I worked with the eating disorder admits. So eating disorder, inpatient hospitalization is very different than what I do now outpatient. So essentially inpatient, we're focused on the medical stabilization piece. So making sure our heart is staying healthy, our labs are normal. There are a lot of medical risk to eating disorders, like cardiac arrest, like really serious stuff. So that's typically what inpatient stays look like, is a lot of medical management. Less therapy and nutrition therapy and education, more clinical. So in 2022, I started seeing outpatient eating disorders, some through the lake, but I worked at another private practice, essentially. So I started getting experience outpatient there, started my certified eating disorder specialist certification, which I just finished this year. So it does take typically for people an average of 2 years to finish, but because I was splitting my time between hospital and outpatient, it took a little longer for me to accrue the hours initially. In 2023, that's when I started my own practice. So I work exclusively with people with eating disorders and disordered eating. I do see some intuitive eating clients. So these are people essentially that, has anyone heard of intuitive eating? Yeah. Okay, so people who are just kind of tired of yo-yo dieting. I find that this is a lot of like my middle-aged women, like 30s, 40s, 50s plus, just looking to improve their relationship with food. So I do see that as well. Health at every size. Has anyone heard of that? Yeah, some of you. Okay. So health at every size. This is the framework with how I practice, and this is something that I think every dietitian now can benefit from versus previously it was not something that was talked about a lot. So health at every size is essentially we are going to talk to you about your nutrition and about your relationship with food regardless of what your weight, your BMI, and all of that is. So I do not do any kind of weight loss, weight management, anything like that at my practice. I do still have people that come in and are like, okay, well, ultimately I would like to lose weight. I'm like, okay, well, I actively do not help you with that. So hopefully most people I can kind of get to a point of weight neutrality where we're feeling at least just comfortable in our skin. But it takes people a really long time, obviously, with the world that we live in, to say, I'm going to give up on weight loss altogether. It just takes a long time. I have had people get there, which is great. Anti-diet, that's pretty simple. I don't give any kind of diets, dieting plans, calories, anything like that. It's different if somebody's coming in who is, example, like a vegetarian, vegan. You know, there are some people who I've started to work with that come in and say, like, okay, I'm vegetarian because I'm scared of meat, essentially, and that's why. But it is something that we talk about a lot, kind of digging into the more moral reasons why. So I'm always cool if people have limitations like that, just making sure it's not coming from an eating disorder perspective. I also work with Project Heal and their healer circles. So I'm sure we've heard a lot about SNAP benefits, issues with SNAP and things of that nature. So access to care, access to food is something that's really important to me. So through Project Heal, I see people, a certain number of people pro bono and low cost every year. But Project Heal is really great because they also give grants to people who qualify for medical or financial assistance. So I have had some of my clients get $500 like grocery vouchers, essentially, because they can't afford food. So Project Heal is a really great resource for that. The spacing was different when I made this, so forgive me. But so Eating Disorders 101, not sure how familiar y'all are with. Of course, I feel like we all kind of think of anorexia being the main diagnoses, but they're characterized by severe and persistent disturbance in eating behaviors and associated distressing thoughts and emotions. So eating disorders are a psych diagnosis. It's through the DSM-5. Even though I'm an eating disorder specialist, I cannot diagnose because I'm a dietitian. So most of the time, my referrals will come from therapists, psychiatrists, pediatricians, or other physicians in the area, and they'll give a blanket diagnosis of, really, they throw anorexia on almost anything, but then I will evaluate and say, hey, we're actually meeting this subtype of anorexia, atypical anorexia, something which I'll explain a little bit more. So they'll typically like trust what I'm saying and kind of give a referral based on that, but I can't diagnose anything. Dietitians can. So it is a psych issue. So the most diagnosed eating disorders, we have anorexia, so restricting and binge eating and purging type. To be diagnosed with anorexia, you have to meet a weight loss criteria. So this is one specifically where weight loss has to be present, and some kind of malnutrition has to be present as well. It has to be significant weight loss. Bulimia nervosa, so that is essentially purging behaviors. This is another one where we do have to meet criteria for some kind of weight loss. Binge eating disorder. This one is characterized by binge eating in terms of large quantities of food multiple times throughout the week or month, but I have never worked with somebody who binges that doesn't restrict somehow, whether that's calorically or I like to say like mental restriction. I can't have that. That's a bad food, something like that. So typically all of the binge eating clients that I've worked with have some kind of restriction. Avoidant restrictive food intake disorder, ARFID. So this one I see mostly in kids, and mostly those on the autism, neurodivergent spectrum. This one is the only one that does not have a body image component. It can, but it does not have to. So I have some people that I work with that they're not concerned at all with what they look like. It's texture issues, sensory issues around food, or I've had some people that have had food trauma, like some kind of trauma. Parents would withhold food, just other things that have triggered ARFID. Other specified feeding and eating disorders. So this one is kind of an all-encompassing diagnosis. So say somebody is not quite fitting into the criteria of anorexia, but we're still restricting, but we haven't had weight loss. Or we're restricting sometimes, we kind of go through periods, we purge sometimes, we include, it's kind of like an umbrella diagnoses. One that is the most, or two that are the most common within that are atypical anorexia. So this is anorexia without weight loss. And then a new one, orthorexia. It's a newer diagnosis. It's kind of characterized by obsession with healthy eating, kind of like I think of, I'll have people that come in and they don't eat seed oils, or they only they can cook their food versus having anybody else cook their food. So that one is and then the one I mentioned, diabulimia. I don't believe that's like an actual diagnosis, but that's withholding insulin in the efforts of. Just some facts about eating disorders. They have the second highest mortality rate of all mental health issues, second to only opioid use. And so the mortality rate comes from, unfortunately, suicide or just those medical complications that can arise with eating disorders. 5% of the population has an eating disorder, but it's likely higher because of misdiagnoses in marginalized communities. I think if we think about who we think of when we think of somebody with an eating disorder, it's a thin white woman. And so we miss, unfortunately, a lot of eating disorders because of our own stigma and weight stigma as well, which I could stand on a soapbox and talk. Okay, so this is just a little about the certification. It's through the International Association of Eating Disorder Professionals. So it's the only eating disorder specialized certification that you can get. So you have to have over 2,500 hours of direct eating disorder care once you're a licensed provider. So this has to be direct and indirect. Direct meaning I'm providing direct care to my clients. Indirect team meetings, emails, really like all of the other things that I do on a daily basis. And then I had to have 24 hours of consultation by a consultant. So I worked with a dietitian in Tennessee who was really great, loved her. She was incredibly helpful. So essentially you bring difficult cases to your meeting and get help on them, because really no matter how many hours you get or how long you've worked in the field, there's always going to be a case, a client, a situation that you don't really know what to do with. Continuing education, 20 hours, which was on top of, or in addition to my regular hours for my registration. But I had to take core courses, final exam, and get 3 recommendation letters from clinicians, other clinicians that. All right, day-to-day activities. So private practice is really flexible, and it's great. I love working in private practice, but direct client care. So these are new assessments and follow-ups. That takes up the majority of my time. I see people in person and virtually, so kind of a mix of both. Emails, I send a million emails. Treatment team meetings and updates. This is involved in my many emails. I'm big on, multidisciplinary care. So I don't put a hard, you have to have a therapist, psychiatrist, on your team, but I highly, highly, highly recommend it. That my clients see a full treatment team. But if we go back to access to care, some people just simply cannot afford to do that. Documentation and insurance claims. So actually going back to the treatment team meetings and updates, I see most people weekly. and then I'll eventually space it out to every other week or monthly. So for my higher acuity clients that I am seeing every week, I'm giving a detailed email or voice update with what we worked on, so the therapist is kind of clued in. I have one client who is very dysregulated, who will talk about and set goals, and she becomes incredibly upset. And so she'll go into therapy sessions being very dysregulated and upset. And so I always like to inform the therapist, hey, we talked about this really triggering thing, and she might be a little sensitive on Thursday. Documentation and insurance claims. Of course, I have to take notes of all of my sessions and assessments and everything. I am in network with insurance, so I do take Blue Cross and United insurance, so I do have to file insurance claims for my clients. And then my time, continuing education, research. The field is always evolving. I think nutrition in general, but really eating disorder care is always evolving and changing. And so I think no matter what area of nutrition you go into, really making sure that you're always kind of keeping up with everything. And then, like I said, I'm also a preceptor for interns at FRANU or student.
So you said that you work with a team. Mm-hmm. Since you have your own practice, like how do you bring in like the therapist part?
Other practices.
Oh, like, so are like all together in like one facility, or?
No, just people that I know or who I've worked with. So typically I'll meet people through networking events and things like that. So they'll have their own practice in a separate area, but when we do meetings, or sometimes I do collaborative sessions with myself and the therapist, it's virtual. Okay. Rarely, there's one provider that I have done in-person collaborative sessions with a therapist.
Will your team like always be consistent, or will sometimes you have a different team for different?
Oh yeah, no, I always have different. Yeah. Sometimes like it's just with personality, like everybody is not going to click with you. And so I'm also big on rapport building and making sure that I'm a good fit for people before, they kind of jump into us working together. So just like that, people have different therapists that they like to work with. I do have like kind of a group, like a list of different providers that I really trust who are specialized in eating disorder care, or who are general practitioners but are very informed with eating disorders, and so can at least manage the mental health side of things, while I kind of help guide them a little bit with the other more specific eating disorder first. Okay, so advice for students, like I said, spend time shadowing in as many different specialties and levels of care. So eating disorders, unfortunately, in the state of Louisiana, access to care in all levels of care is low. So we don't have any kind of, there's one program that just opened in Covington for adult females only. It's a residential program, but aside from that, there's just, and I think there's one inpatient hospitalization in New Orleans still, but very, very few higher level of care. So I would say as well, like, if you are interested in eating disorders, most of the time, if you're planning on staying here, you can get that experience through more of a clinical, like hospital setting. There will always be eating disorder admits there. Other states have a lot more access to care for different types of facilities. So if you don't live here or you're interested in moving, there are definitely places you can shadow. But yeah, even prior to internship, just spending time getting shadowing. I do highly recommend you start out in a hospital setting, unless you're not interested in clinical at all. If you're more of a community or food service person, which are kind of the other areas of nutrition, definitely going that route. But I found that starting in a hospital, not only did it give me a lot of confidence in my clinical judgment, but I got like all of my connections through working at a hospital. So I do find that that's really helpful. And if you're interested in eating disorder care, listen to podcasts. There's so many of them. A lot of different kind of like influencer dietitians too that are part of the eating disorder community, intuitive eating. So following that, continuing ed webinars, a lot of them are free for students. So one of the organizations that I have on the next slide, their webinars, they do like virtual eating disorder training days, and I think you can go to like 6 webinars and get access to them, and it's free for students. Okay, so this is a big one. If you are interested in eating disorders, work-life balance is very important. I work with a lot of high acuity, really sick clients. And so just making sure that you kind of set your own boundaries. And I think in any area really of work, not just nutrition, but I find that dietitians were all kind of like type A personalities. And so we're hardworking perfectionist type people. And so I always say like just working on your work-life balance is really recommended resources, the National Alliance for Eating Disorders. Like I said, they do their free webinars and training days. They also offer free support groups. So a lot of my clients, I used to help facilitate their support groups as well. And so they're all led by dietitians, therapists, psychiatrists, doctors who are all eating disorder specialized. Maybe not with the certification, but they're all eating disorder specialists. And they have many different groups as well. So they have parent groups for family and loved ones. They have people in higher weight bodies. They have a BIPOC group. They have an LGBTQ plus group. So a lot of great resources, the support group front. Books. So Sick Enough by Jennifer Gaudiani. She is an eating disorder specialized physician. And this book goes over all of the medical complications of eating disorders. So a lot of times I do get some backlash with, not necessarily backlash, but a lot of questions with parents, like, do I really need to be eating this much? And if you ever like shadow or work with me, or I talk to Miss Barleycorn's class as well, where I talk about it a little bit more, but just hypermetabolism. And some of my clients are needing like 4,000, 5,000, 6,000 calories a day. And it's really tough for some parents to, if they're teens, to understand like why they need this much food. So Sick Enough, I give to parents to help understand these medical complications. But really great for anybody. Intuitive eating. So this goes over all the principles of intuitive eating. There's a journal and a workbook, and it is really great. If you're not much of a reader, but you would like to kind of go through and even do like a little self-eval of your own relationship with food, they're a really great resource for that. And Health at Every Size by Lindo Bacon. So this just talks about, again, like we're treating the person, we're not treating weight. So kind of goes into talking about that. And EDRD Pros, this is Eating Disorder Registered Dietitian Professionals. They, again, have a lot of free webinars and resources that you can go watch for continuing ed. And that's it. Any questions?
Oh, when you started working in the hospital, were you 100% sure you were going to end up in an eating disorder treatment after that? Like you were going to pursue that, or was there any other field that you were like really?
Yeah, I mean, I loved peds. Like, I feel like I would be happy doing that as well. So yeah, I really enjoyed working with the babies and helping parents like learn how to formula feed and breastfeed and things like that. That was really great. So yeah, and children's here, I will love if you do go to Frania, you'll have a rotation there. It's great because it's so small. Like the residents and the physicians really trust the dietitians there, and you don't get that at many other hospitals. So, but yeah, love that. I think really any area of nutrition that's not weight loss or dieting focused, I could do, but I have my preference.
You mentioned circumstances in which you might be right, having a client eat like 4, 5, 6,000 calories a day. And I think that that is a number that might kind of be almost a shock factor for a lot of us, especially right now, like when we are like calculating needs and things like that in class, we very, very rarely get over even like 2,500 calories. And so I know that this could be a very convoluted answer, but if you could maybe outline some of the reasons why needs might need to be as high as even 6,000 calories, and just some of the things that are like why it is so important and what it's contributing to.
Yeah, so like I said, hypermetabolism is essentially what happens. So when clients first come to me, their metabolism is kind of like in the trash. There's no metabolism really happening, which is why we get things like low heart rate, low blood pressure, GI issues like constipation, delayed gastric emptying, so like our stomach is not emptying into our small intestine, delayed like cognitive processing because our body does not have food. Literally, it starts to shut down. And so that's also where mortality will come in, where we are simply going into organ failure because we don't have enough food. And so then when we start eating again, it is like you drop a match on gasoline. Like your body is so starved for food because it's been going through restriction for so long that it burns through it so fast. And so I sometimes will have clients who I feel like are on, maybe I'll assess their needs at like 3,500 and they're at 3,500 and they are not gaining weight. I'm like, okay, I got to reevaluate because their body is processing a lot more and a lot faster than I thought that they were. So then I'll bump them up a little bit more. Where you have to be careful with this in the outpatient setting is refeeding syndrome. Has anyone heard of that who are seniors? Yeah. So that is also where mortality will come in. You can go into cardiac arrest from electrolyte abnormalities. Unfortunately, I do get a lot of referrals for people that should be in higher level of care. And so I'm big on educating physicians as well and like how to screen for eating disorders before, like I've had people that get referred to me with an 80-pound weight loss in like 6 months. And I'm like, I cannot do anything with that outpatient. Like we have to go to a higher level of care. And because it's out of state, like that's really hard for a lot of parents and families to do. So, when we already have a significant weight loss like that, labs will look normal when people come to me. And that's when they're like, oh, my doctor told me I'm fine. Like we worry about blood sugar and electrolytes like sodium, potassium, phosphorus, magnesium. And so my doctor says I'm fine. But really what happens is we haven't started eating again. And so once we start eating again, that's when they all plummet. And we'll also get hypoglycemia, and just that's when refeeding syndrome happens. So for clients like that, they have to be monitored medically once a week. And like I said, if I don't feel comfortable seeing them, like I'm referring them to higher level of care. But so in situations like that, we do have to start conservative when we're refeeding because of the medical monitoring piece. But then we can start bumping up, and usually I'll do that. And I'm talking calories here, but never with my clients. And so usually I'll bump up by like 300 to 500 calories a week on their meal plan until we're at goal. And we're at goal consistently for months, sometimes at a time. And we're really stable because we also have other pieces like losing your period for my female clients, like loss of bone density, things like that I have to. Yeah. So you just keep going up from there.
How long after getting your RD credentials did you get your certified eating disorder certification?
I'll be registered in 5 years in December. So 5 years, but really like you could start on it if you're starting off in like a fully eating disorder space.
I was gonna ask, would you recommend like that earlier if you knew exactly that's what you wanted to do?
Yeah, definitely. The thing is with it is it's very expensive. So not only are you accruing hours, but like my supervisor costs like $200 an hour or something crazy like that. So they are trying to make it more affordable because it is the only eating disorder specialist credential. But yeah, it's just an investment. Some places will pay for your supervision. So like different eating disorder treatment facilities, if you do work there, some of them will give you credits and pay for your supervisor. Or sometimes your supervisor will be the nutrition director. They might also have their C credential. So I'd like to start doing more supervising. Hopefully I'll be able to apply for that in the next year. So.
And would you have changed anything about your process to getting there?
No, I don't think so. I think like everything has worked out. Like I would have loved jumping in like right into working into private practice and being like super flexible with that. And some people do and are very successful with it. But I found that just my clinical judgment was a lot better working out. I think there's someone in the back that had a question.
I know you said you started out in clinical to like have more like specialist positions. Are you still in the process of getting credential, or did you already get the chance to learn while you're getting your credentials?
Yeah, so I was already working as an and seeing eating disorders as an eating disorder dietitian without my credential. So you don't have to get it. It's definitely not necessary by any means. So yeah, you can start it as soon as you can. What's helpful here, you can start working in a clinical field, and there are a lot of places who may hire like a PRN or like an as needed dietitian to kind of like fill the space. So you can start to dip your toes into eating disorders and see like if I like this before I'm committing to it full time. So that's what I would recommend too if you are interested in like I want clinical experience, but I do want to start with the eating disorders like as soon as I can.
So you spoke about like working with insurance, and I know just like with family members and things like that, getting eating disorder care, there's a lot of conflict there,
Yeah,
and a lot of. So how do you work with insurance? What are some like I guess major conflicts that you run into, and if you have any resolutions or advice with working with insurance?
So, the thing with insurance is that you can bill more as a private pay provider. So like insurance only reimburses so much. I can say my rate is X dollars, but they may only reimburse like 75% of that. What I've found just with the current state of financial situations for many people is if they have an insurance plan, they're like, awesome, this is great, I'm going to get everything covered, and then they find they have a deductible. And so that's where you have to pay a certain amount before insurance pays for your treatment. So like essentially you're paying out of pocket to hopefully get everything fully covered. So that's where I find a lot of the, like it's covered, but after you pay $2,000. And so that's challenging for a lot of people. Most of the time, the denials come from higher level of care. Certain places only accept certain plans. Louisiana, we are a majority Medicaid state. And so I don't accept Medicaid because their reimbursement, they don't reimburse for things other than kidney disease and diabetes. So, and unfortunately, like only certain higher level of care offer Medicaid. So that's an issue as well. You can do single case agreements. So that's kind of where I'll fall into play, where I contact Medicaid. I'm like, hey, they need specialized care. Will you pay for their care for like 20 sessions? And so that's kind of where outpatient, but most of the denials will come from somebody needs residential and they're like, no, they don't. Yes, they do. So insurance is a beast.
Could you elaborate some on the process of starting your own private practice and some of the challenges that you may have had?
Yeah, so I think it was really just the growth period. You just say you have to wait for referrals to come in. And so that I feel like was the most challenging part, and learning insurance, because not everybody accepts insurance because of some of these red tape things. And so I had to learn, like, I didn't know what a deductible was or a copay or, so I had to learn all of that. And I feel like that was the most challenging. And I think managing the business side of things in addition to the clinical side of things. So it's like you have to have like books and records that I'm keeping and receipts for my taxes and, all of those things. So I think just managing both and learning how to manage my time. Because private practice, when I first started, I'm like, I'll get an email at 8 o'clock, I'll answer it. And it's like, it's 8 p.m. Like, I'm not logged on. So like, there are things like that where I was doing billing and answering emails and insurance questions, and I would be working like a essentially a 12-hour day because I'm, doing all the back end stuff. And so I feel like getting my footing with knowing when I want to be working was probably the most challenging part. But like I said, working somewhere else first, I didn't have to worry about referrals. Like that's something that, I already had people that knew me and had worked with me previously.
Do you recommend starting out like maybe working with somebody else in their private practice like you did before branching off to do your own?
Yeah, like I think that's helpful as well, like kind of learning the ropes of everything with documentation and more of the business side of things. Well, thanks, y'all. Like I said, if you ever want to shadow, like I said, things are going to change for me in the spring, but I will try to accommodate everybody like as best I can with shadowing. So that's my contact. Thanks.
Yeah, that's oh wait, yeah, maybe
Ava, would you like to
Do you want to get in a group picture?
Oh, yeah, for sure. Yeah.
You want us to stay or like all like?
I was thinking we could stand around, like,
Okay,
if you could pull up your cover slide for me.
I will.
Thank you. Thank you. Thank you so much.
Oh yeah, no.
Thank you. Of course.
Not exactly the most exciting title, but it's fine.
Wait, y'all come in.
Oh.
I was like, yeah.
Let's start here.
We can stagger. How about like our short people like squat?
Oh yeah. Short one.
Oh, I'm short. Yeah. Perfect. Y'all come in. Why? It's okay if you really don't.
Okay.
It's okay. All right, great.
Thank you. We have a little gift for you.
Oh, God, thanks.
Thank
That's so sweet.
you.
Yeah. Oh, yeah. No, I love it. My husband went here, so.
Oh, okay, great. Yeah.
I'm an LSU fan by marriage, so.
Perfect.
Well, thanks y'all so much.
Yeah, of course, and I can walk you out too.
Yeah.
We have a little bit of announcement before we wrap up. I'm gonna skip this part.
Also, make sure it's assignment fee. It's going around.
Okay, so a little bit of a question for y'all. What's your favorite candy or like sweet treat? Question of the day. Yeah.
Kit Kats.
Kit Kats. I haven't had Kit Kats in a while. Have you had the orange ones?
No.
They're good.
Are they?
Yeah. It's like white chocolate.
Okay.
But I don't like chocolate, but whatever.
I made these like brown butter like cookies that are so good.
That sounds good.
Reese's are good.
Reese's?
Have y'all had the cookies and cream Reese's? Those are new.
Oh,
I had them the other day.
I like the cookies and cream Hershey things.
Those are.
Yeah.
Well, what about the Trader Joe's peanut butter cups? Never had that.
What? Oh, I love the Trader Joe's.
Trader Joe's Reese's.
Scandinavian swimmers. Have y'all had those? They're like the only candy like I'll eat.
Oh my god.
And Skittles.
Skittles.
I don't like chocolate, so I feel like that's like
That's a lot.
yeah.
That's great.
Okay. Emily had this idea. So Emily, what's your favorite?
My favorite candy is Reese's peanut butter cups, and I'm like very, very passionate about that. That like has to be the right answer, right?
Have you had the cookies and cream Reese's?
Oh my god, have you?
Yes. Wait, okay, no, everyone's excited when we did that. They're so, I tried them over the weekend, they're so good.
Have you tried the reverse, the like Reese's
No.
Okay.
Wait,
Reese's
the
Reese's
Oreo?
Oreo cookies.
Yeah.
They have like Oreo cookies now. It's like a Reese's filling and that's gosh.
Oh,
Okay, I'm
It's
getting
like both.
No, the Oreo Reese's are so good. So good.
Okay, so we're gonna try new things.
Yeah.
New candy cookies.
No, I'm glad you understood the height.
Okay, so some announcements that we have for y'all is we're going to have our next meeting, it's gonna be November 5th, at this time at 6 p.m. at this location. Actually, no, it's gonna be a nap. It's gonna be a nap at 6 p.m. And this fall mentoring and network event. We're going to have like little pumpkins that you can paint. And you get to meet other members, especially like I think for like our older class, you get to meet the new members and talk to them. All of them are like nervous and scared about this path, so you get to give them some comfort while painting a pumpkin. Plus, you get to hear from Dr. McKinley on how to succeed in your program and make the most of your journey at LSU. And then one more thing that you can bring your non-traditional items for our Thanksgiving basket that we make every year. So you can bring it to this meeting and we can start collecting them to do our Thanksgiving drive that we have. And so you can bring cans, really like any Thanksgiving thing that's not like perishable, like nothing fresh. And you get a service point for that as well. So it's gonna be November 5th, which is next Wednesday at 6 p.m. in Nap Lounge. And then congrats to our chairman positions who got this. Is anyone here right now? Okay. Oh yeah, our social media chairs, our historian. So yeah, good job, y'all. Proud of you. Okay, and then if you didn't join the group me from last meeting, here's the QR code for it, but it'll also be in the meeting, wrap up email meeting. And then these are just things that were past due. If you haven't done, has anyone not done these yet? You should be honest. Perfect. Okay, and then these are just our upcoming fall meeting dates. So again, we have ours next Wednesday, and then our last one is going to be November 19th. And our speaker is...
Her name is Brooke Lowenkron, and she is the switch from last time. It was going to be the Eat Fit lady, but now it's going to be Brooke, who's an eating disorder dietitian, but she's also the president of, it's some acronym, but it's something for the board of dietitians for Louisiana. So she's like,
So she'll talk more about that.
yeah,
Like
Yeah.
another
She's very well known.
famous dietitian. She's really good friends with Dr. McKinley too.
Yeah.
Yes.
And then this is just a member spotlight that we introduced last meeting. You get to fill out a little form about anything cool that you're doing, whether it be academic, professional, leadership, and we get to feature you, and we can feature you on the Instagram and also our next meeting as well. We just want to know what you're up to and celebrate your accomplishments.
Oh my gosh, that's my accomplishment.
Yeah.
And then I don't know if y'all know, whenever Ella like sends this out, you can click on this and like it'll give you all of the opportunities. There's 7 pages of like lots of different volunteering opportunities. I'll go through all of them. So there's always like lots to do. You can never run out of things or ideas.
Wait, can I just say something? If y'all do volunteer and take pictures of it, just send it so we can like post on the Instagram of volunteer stuff. Type y'all up.
Yeah. Yeah, that was like 8 pages of stuff. Lots of options. And then this Friday, we're going to table at Free Speech Alley, which is like right outside the Union. Come get some, like stop by, get some candy, some treats, say hi. And then our last event that like AG is hosting is finals field. They still have not given me like a location for this part, but you guys should grab like they're gonna have a lot of like energy drinks or just like pick me up things for yes. Sorry y'all, my brain. And then that's all we have. Y'all have a very safe Halloween. What's everyone dressing up as? If you celebrate or celebrating this year. I'm not celebrating this year. I gotta study.
Dressing as employed.
Original.
Yeah.
Anyone else?
See the green M&M. That's food.
Oh, is that your costume?
Yeah.
I love that. One more.
I'm gonna be good though.
Oh, nice.
So the dress. Don't mess the dress. It's actually really good.
Does anyone have any questions before we wrap up?
Are you gonna send out this video today?
Yes, we'll send out the recording and this as well. Not either tomorrow or Friday. Definitely by Friday. That's awesome.
I don't know if y'all can see it.
It's really good.
Okay, awesome. Well, thank y'all so much for coming out. See y'all Wednesday.